T-DXd Trastuzumab deruxtecan is an anti-HER2 ADC, which showed activity for gastric cancer in multiple studies. For example, DGO1 has a third-line, later-line treatment to compare cytotoxic chemotherapy and show the survival benefit. DGO2 is a second-line treatment in non-Asian population, which also showed activity. And this trial showed multiple indication in multiple countries. However, there's no randomized study to compare T-DXd and another global second-line standard of care, paclitaxel and ramucirumab, which is used regardless of HER2 status. This DESTINY-Gastric04 is a global randomized open-label phase 3 trial to compare T-DXd and paclitaxel and ramucirumab as a second-line treatment. So this is a phase 3 randomized study, and the primary endpoint was overall survival. And we also test other secondary endpoints like progression-free survival, confirmed response rate, duration of response, disease control rate, and safety. And also patient-reported outcomes are also exploratory assessed. This trial showed statistically and clinically meaningful improvement of overall survival with T-DXd compared with paclitaxel and ramucirumab. Median overall survival was 14.7 months with T-DXd and 11.4 months with paclitaxel and ramucirumab, showing 3.3 months difference in median. And the hazard ratio was 0.70 with a significant p-value. I believe this median exceed 14 months should be the longest median survival in global second-line phase 3 study. And this study also showed a PFS and response improvement. Actual confirmed response rate was 44% with T-DXd and 29% with Rampac. Also, these results clearly support T-DXd as a preferred second-line treatment for HER2-positive gastric and GG cancer. I would also mention toxicity profile of this treatment. Common toxicity with T-DXd include fatigue, myelosuppression, and GI toxicity. And common toxicity with Rampac include myelosuppression, fatigue, peripheral neuropathy, and hypertension. Importantly, pneumonitis or ILD is more commonly observed in T-DXd, same as the previous study, but most of these events were grade 1 and grade 2, and we could conclude this as a manageable treatment. Surely in clinical practice, we should carefully manage patients, but based on this result, I believe T-DXd should be preferred second-line treatment for global population for gastric cancer.